Good morning, everyone. I'm very happy to see that even though we couldn't meet all together in one room, we can still make this conference happen. We'll try to make this the less awkward possible, while of course doing it online still feels awkward, especially for a project like ours, which is essentially about meeting and being together and creating together. Just before we start, I just want to how many of us represent which field and which background. So if I could just make a little experiment and ask you to do some reactions. Could I ask first to put the clap button for those who actually come from the artistic field? Hey, great. And can maybe I ask the clap for if there's someone who comes from social and health sector? Great. So at least we know that we can all clap, and at least we have a little bit of diversity in our between us. So we will have. Yeah, sure. We're here all together in Zoom, but actually we are live on Facebook as well. So we're many more than here. We're having followers as well who watch us online without participating. So I'm going to try to be short. We're opening this conference, which is the end of more than a 2-year project called Wellbeing Residency Think Tank Network. The project idea was born in December 2016 when I met my colleagues Matis Helen in Russia, and he was presenting their project where they have been starting these type of artistic residencies in retirement houses. It immediately sounded as a great idea, and together with our now long-term partners, Hanna and Ekaterina, we decided, and our colleagues from Vista in Finland, we decided that this is something that should be more widespread, but as well it needs a methodology, and we should be more aware of actually how to do it. So just a short introduction about what's Wellbeing Residency. The idea is that it is a mutually beneficial form of artistic collaboration where artist residencies take place in a close type of social or health care organizations and institutions. The idea is not about art therapy. The idea is really about high quality contemporary art creations and giving the rights to everybody to be a part of an art form and an art creation process, nevertheless, what is their situation and where do they live. So there is both benefit for the artist and for the participants, and there's both need for this for the artist and for the participants. We decided this project is needed because at the moment there's a lack of these type of collaborations between social and medical care sector and the art sector. So we created this network. Initially it was a 2-year project, but due to the corona and time that we needed to gather all the funding to create this project, it became a bit longer, I would say almost 3-year project. And we created first 5 think tanks, first opening session and then 4 more think tanks to discuss about what would be the best methodology, inviting experts from both artistic field and social and health care sector. We were organizing 3 conferences already in Sweden, Russia, and Latvia, where we're inviting similar experiences to be shared so we could learn from that. And then we have been working for those 2 years as well on a toolset methodology that will be published and sent to each of you at the end of this week on how to do these type of residencies. And then finally, each of the organization did a tryout of around 1 month of Wellbeing residency in their organization, in their country. And these experiences will also be shared in the publication. And these experiences will also make the biggest part of the content during the next week, as you are going to be able to meet the artists and as well representatives of the organizations during the sessions tomorrow, Wednesday, Thursday, and Friday morning. Here you can see a little bit of project timeline is what I already explained. The first part of that is more theoretical, and the second part has been very practical. So I'm very hopeful that you will enjoy this conference during this week, and that you will take out from it what you are expecting, and we'll be looking forward as well to hear from you. What are your expectations for the publication, and what are your ideas to continue going on with socially engaged artistic practice? Thank you very much. I'm going to give the floor back to Jānis, and see you soon.
Thank you so much, Māra. We will continue with Katherine Taylor, the senior clinical psychologist. Kate, the floor is yours.
Hello, everyone. Thank you, Maura and Jānis, for setting this up. So my name's Kat, and I'm a clinical psychologist in Greater Manchester. So I work clinically directly with children and young people. But the reason that I'm here today is more my other job, which is about managing an arts, culture and mental health programme. And the aims of this programme I'm going to talk more about, but they're not necessarily wellbeing residencies, but they are arts interventions in NHS services. So I'm going to talk a little bit today about a bit of the background and some of the research findings of why this work is important. Then I'm going to give some examples. Unfortunately, like everybody else, Corona has delayed this programme somewhat. And so in it, without COVID, I would be talking about the examples that have already happened, but they haven't happened. So I can only tell you about what we plan and what the aims are. And then I have some slides about the kind of policy and recommendations of some reports that have taken place in the last year or two to sort of support some of this work. So I hope that sounds okay. Oh, okay, my slide's not moving. Okay, thank you. Did you do that, Maura? Okay. So these challenges was something that Maura produced in the last workshop in Latvia, and I thought it was very helpful to think about some of the reasons we need this work. And so Maura outlined that art services rarely go beyond the traditional art environments, and for this reason a lot of people are excluded from arts, and this reinforces inequalities, and we've talked about this in our group just now. The fact that activities are often organised by healthcare staff means that you kind of miss on some of that quality when an artist, a professional artist, is delivering. Another thing that I think this project might address is the problem that arts professionals are often brought in a very short-term way. So they're kind of like parachuted in, they do the art and then they go out again. And you've got to think about the impact on a community for that. You know, there's a kind of lack of a legacy, and I know that the toolkit and the publication explores a bit about legacy and why that's important. And then lastly, there's this the concepts that people have in mind before these projects start are often very different depending on your background, and so some of the preparation needs to happen around the expectations of different people. Okay, now I can't use the, can you move me on, Maura, please? Thank you. So creative group sessions, as a kind of overview, one of the reasons that they work so well in clinical or care settings is that in general, they can be mostly failure free. You can set up an activity so that everybody can have a go. It promotes patient choice and individuality, which is very sort of empowering. You can be skills led as opposed to maybe being more diagnostic or symptoms led. It can be very leveling, so that everybody, you can see in a photograph, everybody kind of has a role, and sometimes during these sessions it can be difficult to see who is the patient, who is the doctor or the nurse, and this can have quite a profound effect on people. These activities can foster achievement and pride, which are, you know, big ingredients of mental health. Interestingly and importantly, for especially in the NHS, this can support staff wellbeing because it can help soothe stress among the clinical staff. Generally, there are no side effects to, say, singing or dancing in a setting, and it can provide a tranquil environment, and some research shows that fewer meds are required with these kind of interventions, although that is something that hasn't been studied to any great extent, and we need more research on that. Okay. So this is just a kind of collection of some research findings. Thank you. And obviously you can have these slides. There's a lot in these slides for 20 minutes, but I just wanted to provide some background. So in a medical setting, you know, there's research showing that playing music to a patient can improve outcome, and again can lead to less medication use when preparing for an operation. When it comes to mental health and finding your recovery, songwriting and poetry and even journaling has been very effective in helping people create a sense of reflection and problem solving. When it comes to inpatient services, especially with adolescents, researchers have found that combining music and games can decrease substance use in adolescents, and this is high-risk adolescents as well. So I think some of this stuff is obvious, but these are actually research findings that people have reported. When it comes to the perinatal period, so pregnancy, birth, and then post-birth, singing groups for new mothers and babies, there's been some research on that in the UK, in London, and they found that singing groups can support recovery from depression, but also to improve attachment between mother and baby. And so that obviously has an impact for the lifetime, arguably for the next generation too. And again, no side effects. Education, this is very pertinent now to the pandemic, because we were just talking in our group, the UN asked for artists to help educate the population about disease transmission. When the Ebola crisis happened, this also took place, where artists were instrumental in helping people understand better health behaviours. And as we've said, calming the healthcare environment can also support outcomes. Okay, can we go? Thank you. So some of the mechanisms, just for that kind of the science behind some of these things, it's just so fascinating. And when you look at the impact of music, there's a current research study happening now, and the researchers are looking at the different mechanisms that singing has, and so far they've identified 600 different mechanisms. So this is includes these sorts of mechanisms, so the kind of hormonal, neural, I've lost the word, your oxytocin and your cortisol, and all those kind of neurological chemicals that happen, but not just that. They've looked at things like the impact on behaviour, the impact on how you react to other people, and so these sorts of interventions can produce oxytocin, which leads to bonding between people. And you know, people need other people. That's kind of one of the most powerful ways to feel better and to soothe the system and to regulate emotions. The final one at the bottom is about awe, and the experience of awe does lead people to make more pro-social decisions. So people are more likely to help others after they've experienced awe. So in a place like Finland, for example, when you have the beautiful forests and the huge nature, you know, awe is quite easy to access. Whereas somewhere like Greater Manchester, it's a very heavy population, it's quite dense, how can we engender awe in the population? It might be through the use of art and culture to give people that sense of connection and belonging. Okay, can we have the next slide, please? Have we lost Maura? Okay, thank you. So again, this is just a bit of background really, but there is a wide literature on the potential evolutionary roles of the arts, as I've said, in particular music. And I think the point of this, so we've talked about the different layers of impact. So you've got social bonding, behaviour, coordination, it can improve attention. And the point really is that if you try and put this in a scientific model, it's easy to say that the evidence is not there. The evidence is there, but it's just so spread out across different fields, different specialties. And you need to like zoom out and look at the whole thing together, because if you only look at, say, blood pressure or breathing, that's a very simplistic way to understand a multimodal intervention. Okay, next slide, please. So in terms of this project and a wellbeing residency, it's quite helpful to think about why or how these things are helpful, so that you can target them to particular problems that you're trying to solve or particular populations. So because the arts can be helpful in solving or aiding conflict resolution, helping people to take perspectives, so working with multicultural groups or people who maybe don't share a language, art can be very useful in uniting people. When encouraging healthy behaviours, so as I've said, the messages that artists can deliver are more likely to land in some places than they are from experts or health providers. Trying to build trust around sensitive topics, so there's been some great work looking at sexual health among adolescents and how when you put that into a more creative package, their sexual health behaviours improve. And then, yeah, problem solving, because in reality, or in simply put, creativity is problem solving. You know, cognitively, that's the same thing. And so it makes sense to bring the arts and culture into complex problems. Okay. That'll do. Thank you. So the World Health Organization published this report last year, and it asked the question, what is the role of the arts and culture in supporting health and well-being? And their recommendations or their conclusions were that there's a substantial evidence base and we should support the implementation of arts interventions, and that everybody should share knowledge and practice where we know that arts interventions can promote health, improve health behaviours, address health inequalities and help recovery. So again, there's kind of this multi-level thing where you can help prevent poor health and help recovery. Okay. So the current context here, I'm referring to the pandemic, to COVID. So currently we have a situation where lots of communities are either displaced or disconnected from each other. Physical spaces are altered, and that therapeutic communities might require some redesign. And obviously issues of isolation need new solutions. Thank you, Maura. So can we just go back one? Fab. So the current context, we have problems, but we also have opportunities. This one, that mental health clinical spaces are commonly inadequate. They can be very small or cramped. They, at best, are uninspiring, and at worst, can be quite stigmatising or medicalising environments. They're often, in the UK at least, located outside the mainstream. And by that I mean out of town, hidden, you know, they're not kind of present, very narrow in their clinical offer. So by that I mean the offer is often CBT, so cognitive behavioural therapy, maybe family therapy if you're lucky. There's lots of different types of therapies, but generally they all involve sitting, talking, in a clinical space, or medication. And so this might be suitable for some people, but the point of the programme that I'm managing is to broaden the clinical offer so that people can engage more on their terms and with their skills and interests. And so this is the final point really, is that the current offer, the mental health offer, can often be rejected by service users, particularly young people, because they don't want to kind of get into mental health services. There's lots of reluctance maybe for some people around doing that. So if we can repackage things in a more skills-based way and a more community-focused way, more people may engage. Okay, so the next slides are a series of photographs from people who work in arts and health in Finland. And so I asked them for their understanding. So art is a journey of imagination, so this can help problem solve. More genuine encounters. So this lady thinks that the arts can help people connect, and we've heard this, that there's that more human touch, more genuine through the arts. Tolerance, so again, taking different perspectives, and cultural interventions can support that. This one's great. Use the arts and culture to take mental health promotion, communities and new audiences. So I thought this idea, this is a man who launched the Scottish Film Festival, the Mental Health Film Festival, and this is about changing the public perception of what mental health is. Okay, any more? So this is the ultimate aim really, art as part of everyday healthcare. And this is Timo from Taika in Finland, who's one of the partners on this project. And I went to do some research with them in 2017, which is where these photographs are from. So thank you to Taika. Again, art removes stress. This is the really obvious one that everybody, like the general population, thinks about. But there's many more benefits to it than just removing or addressing stress. Okay, so this is bringing us to the programme in Greater Manchester. So young people want and need more than traditional treatments. So cultural and arts-led options alongside the existing offer within child and adolescent mental health services comprise empowering, safe and cost-effective approaches in fostering positive and sustainable change in a young person's recovery journey. So we hope that we can redesign a little bit of the options so that young people are not defined by their symptoms or their problems, but that we have more positive skills-led interventions that also, again, don't necessarily carry side effects, because a lot of the young people that I work with do experience side effects and do sometimes use the medication to take overdoses. And so if you can offer something that's less invasive, this is a good opportunity. Okay. So we're talking about the programme now, so the Mental Health Innovation Programme. So this is a 2 or 3 year programme. It may be longer, but in the first instance. So these are the 4 aims. Firstly, we try to map current provision. So for those who are not from the UK, Greater Manchester is a large region that's made up of 10 boroughs or cities. So there's 2 cities and 8 towns. So it's like a big area in the northwest with 2.6 million people who live there. And it's a little bit independent from the government in London. We have devolution, which means we have extra or independent powers around around health and social care. And so there's a lot of innovative work happening and a lot of innovation around the healthcare system and the models. So the first thing that we did was map current provision in terms of who and where are healthcare providers partnering with cultural sector. There's many theatres, galleries, youth-led places where there is existing partnerships between health and culture sector, but this is very informal or patchy, and so we've mapped what that looks like, and we also surveyed the healthcare sector to ask them, what are your views of the arts and culture? What do you think is the role? What would be helpful? What would be a barrier? And so we have a lot of information from across this area as to what's happening and what people want to happen and what would help. Following that, we then redirected some money from health into the arts and required for, what's the word, we made a contract with the healthcare providers and the arts providers that you have to have both people present in the room. And so we gave money to the cultural sector to deliver mental health interventions together with healthcare. And the idea is to pilot some very innovative projects where the two partners deliver together. And so we had training to support that. The third aim is that we have developed a cross-sector evaluation framework. And so that looked like a series of workshops where we got all the actors in the room. So people from commissioning, so the decision makers, clinicians, managers, artists, academics, dancers. We had a lot of people, and we asked everybody, these are the tools that are used in the UK to measure outcome. And so the NHS uses a set of formalised outcome tools, and they do this all the time. And the decision makers say that, one sec, I need to turn my, right, it's okay, battery. So the decision makers will say there's no evidence for dance interventions for mental health. But the problem is that they have not been collecting the right outcome tools. So now we have a situation where everybody in the cultural sector has the same tool or set of tools to collect outcomes. And then in 1 or 2 years' time, we will be able to say to the commissioners, these are the outcomes, and you can compare to the healthcare sector, because they were just collecting different things. So finally, we want to develop and deliver training to both parties and try and really embed some more of this partnership between the health and social care and the cultural sectors. Okay. So the top 4 here, those are the 4 I've just said. And how are we doing this? At a kind of management level, we have needed senior leadership buy-in. So the people who are in control, you know, we have the Mayor of Greater Manchester who is behind this. We have support of the clinical leads. We have support of the people who make decisions. Not everybody is on board. Some people think that this is fluffy, meaning soft, or alternative is the other thing, which I can understand if you are trained medically or, you know, in social work or psychology. This seems like it's outside or alternative. But I think people are starting to think that this stuff is kind of a key ingredient that supports wellbeing at the root. So we've needed senior leadership buy-in, which gives us access to all these networks and all the ways to share this work. We've needed genuine partnership with cultural leaders and key players, because obviously we need real relationships, and we need to listen to each other and feel that everybody has a say. And there's other things that come with that. So if we've got genuine partnership with the cultural sector, this gives us access to more inspiring spaces, more inspiring ways of thinking, because an artist will generally have more cognitive flexibility because of the nature of being creative. And then lastly, we've also needed the ground level support of the people who do this work. So we've worked very hard at trying to keep the people on the ground engaged. So if you go to the next slide, we have this is a kind of campaign that's out across Greater Manchester. So we're saying we're helping Greater Manchester to understand the value in arts and culture to support mental health. And we've invited people to become an ambassador. So people sign up to our programme, and then they receive tools, videos, podcasts, research findings, slides, just anything that can help them to embed the arts and culture into where they work. And so we offer Ask Us Anything, we'll answer questions. We also offer original artwork by young people to hang in clinical spaces. So we're trying to get people to kind of talk the talk, walk the walk, and support them into getting this stuff more widely understood. Okay. So this is one project that's happening, and I would encourage you to go to the website. So 3 Minute Heroes is a songwriting project that happens in schools. Children and young people are encouraged to write down on paper what bothers them, what's on their mind, and it's kind of located in school in the curriculum. So it's not a wellbeing residency, but it is a kind of weekly intervention that's in the school. So there's a songwriting residence, and then those lyrics get given to bands in the area, and an album is produced. So that it's really high quality, there's music videos, and it's all mental health themed. And we've just launched the second album this week. So it's a great project, and we are evaluating that as well at the moment. Okay. So how, I've said some of this really, but the second point there is you need experiential workshops. So rather than telling people that this works, I found you need to give people an experience that they participate in and realize, oh, my thinking got bigger then, or my thinking was easier because of the art catalyst. So you kind of need to give people that experience of an emotional experience rather than showing research findings. I've said the other two, we need to be evidence-led, and that's really important, especially in the UK. Well, probably most places where we need medicine is very evidence-led. And we need to work with system strengths, so kind of finding those people who are more likely to help you. Okay, so I'm nearly finished now, maybe 2 or 3 more slides. So in terms of the UK, the policy direction is that there is increasing interest in this. We have the Mental Health Foundation just featured creativity and innovation in their series briefings. And there is now a national social prescribing network, which is linking people into cultural options in the community. The Culture, Health and Wellbeing Alliance is a group of people who are working on this kind of work. And yeah, these are just here for you to follow up if you want to follow anything up. The next few slides are mainly references. So we would recommend that structures and mechanisms for collaboration are strengthened. And this is one thing that the publication of the think tank aims to do. So this think tank publication kind of looks at some of those pathways, some of the things that you need to be thinking about if you're going to do this work. So how do you refer from health into arts? How do people know what to expect? And yeah, training and the big role of training. So I think this publication covers a lot of this in it. Okay, so this is the last slide, I think, before references. So how can we support healthcare to commission arts? So one, like I said, state the evidence, back up everything you're doing, find the evidence, find references. The Creative Health Report from the UK in 2017 is a lot of references in that. There's the World Health Organization report. Find out how you can put what you're doing into research terms. State the rationale, so you might have to explain to people who might be quite close to these ideas why the arts have such a range of benefits. It's not just about reducing stress. Not just benefit.
Не отключена камера. Да, я тоже хотела там предложить.
As the arts collect outcomes yourself, and again, this in the publication, how you can evidence the impact of your program. A useful thing is to demonstrate how the arts build and draw on community resources, and finally, to take care to avoid presenting as either or. Okay. Well, I think this is the final slide. After this slide is reference resources. And so there's a selection in there that you can look at in your own time. And if you go to the, I think if Maura's still in, if you go to the final slide, Maura, just for my, keep going, yeah. So, oh, I was just going to say it's my contact details. So if anybody wants to email, ask questions, or on Twitter, I use Twitter to share research findings and things. And I'm happy to hear from anybody. And thank you very much for asking me to take part today. Thank you.